with a picture of Ayurvedic doctors, something like this, in many people's mind. But let me tell you that we have changed to the right side since last many years. So what you see right now in front of you is something which we are trying to work out, going towards this Vikasit Bharat. So there is something which is in Ayurveda, which is Vikasit Ayurveda. So I am going to tell you something related to the things which we have developed through Ayurveda in terms of pain, and here we are talking about cancer pain in particular, and that is what we expect, that anybody coming for treatment after getting the integrative therapies, you should be getting out with I am better. And I know my limits, that I am not an oncologist. I am a simple Ayurvedic physician. Maybe learn a little bit and then develop something related to pain management. So at present, I am focused on to what I am going to talk is Vidagni, that is symptomatic relief. But symptomatic relief, we can go together and we can have better quality of life for our own patients. I will tell you my own story. Whenever we get patients for different kinds since last 30 years, maybe a patient or two in a month of cancer used to report to us. And they were coming, okay, is there anything in Ayurveda? We used to say, okay, we'll try. And whatever they used to take was altogether rejected by their oncologist. No, you can't take. And now the stage has come where oncologists say, okay, you are going to that. He's practicing Ayurveda, I know him. You can take what he is giving. So that much change we have seen, and the number of patients coming to us from 1 to 2 in a month has gone to around 10 to 12 per month, and they are following both pathies together. So at clinic level there is integration. And sometimes we also discover that the patient is having cancer. It could be sudden due to some pain and other things. They are coming to us. We go for the investigations and then we find them either in early stage or the later stage. And I am focused on the pain right now, not the curative stage, because that is something which will need more integration. So at present, this is where we are looking to, that somebody who is having pain due to cancer, they also land up with us. This is the internet data which I have seen. This is the percentage, and it does correlate with what we are doing. So in the initial stage, just controlling the pain is our target. If patient benefits, we move ahead. Generally, this is the triad which everybody experiences. There are some inflammatory stages, there are some tumor invasions or treatment side effects. But ultimately, when we find any patient with pain, it could be cancerous or something different. This is how we see them. And this is the ripple effect. So when we are looking to it on scale of pain, if patient is having pain up to 10, and if we want to divert, as Sir said, that he has to divert his mind, but he will be more happier if we can control his pain to the extent that there is no need of any medicine, because medicines in any case, even the physicians coming to us for their patients' pain management, they come, oh, please give something that will not hamper onto his liver or kidney profiles. So we have something which is totally external, and this is the, I would say, sort of blurry picture where you don't know exactly what pain it is, but they come to us, and this is the integrative toolbox which I am going to show to you. All the things which are discussed as non-pharmacological. On one side, there are massage therapies, as Yunani said, that could be something like hammam, or some therapies which may help them. Something which I have with us is with the Agni and with the Agni. And we are trying to change perception about ourselves through this with the Agni. So let me tell you again that whenever there is very severe pain and we don't have to give any medicine, how we have developed this Vidagni concept and how it is scientific, because we have to see that it should be scientific thing also. So first is initial idea of controlling pain. Then we had clinical trials. There are around 16 MD researches which have already been done. 3 PhD people are doing. It is across 20 states already and in 6 nations. So we have enough evidence that Vidagni works in pain management. And we are focused right now into instant pain management. And now it is into clinics of more than 1,000 doctors right now. So that is what we are trying to work out. First, access pain, apply intervention, that is Vidagni, measure relief duration, it could be few minutes to few weeks, and decide about what next has to be done. So when we move on, this is the total generalized, I will say, diagram, but one by one, we are trying to work out with the root cause. We are trying to control the root cause through different treatments. As we are dealing with cancer, it is the primary treatment which we are focused on. We are trying to work out with some treatments. These treatments are either for the cancer cells or the things which are making cancer spread across. We apply Vidagni. It helps us to control the pain at different levels, just like the gate control theory. It is blocking the pain. So we are working on that, and we are here for the ripple effect. That yes, Ayurveda is there, which is in a different form now. It is not what was maybe a few years back perceived by the world. We have also changed, and we have changed to such level that we can say we can have some researches and innovation in field of cancer through case studies. We are onto that. Clinical trials are going on. Collaboration in integrative oncology departments, we are expecting it will be happening here. This is what we are trying to work out. And first of all, it is very fast, clean, and along with that specific. We can target and then work out. This is something what we are doing, and just go through it. Middle insertion is most important part, which is called as Vedal. Then we have application of heat, and it is up to 8 millimeters. So this is the process. First, we clean the place, we mark it out. There are some specific ways to mark out, specific ways to insert pain. These things are totally scientific. If anybody wants to learn more about it, we have different workshops, and currently I am working with one university for bringing it to the national fora.
Ancient wisdom, Ayurveda,
modern precision, technology,
Vidagni Karma.
So these are scopes. These are some areas where we have already worked in terms of pain, and sometimes we have worked for controlling the disease itself. As we were trying to know how it happens, this is how we connect the machine. a simple way to explain what we are doing, and this is the future which we feel that it can be used in actual interventions. At present, we are just trying to be with the current oncology treatments, but this is something which we are expecting that some solitary tumors or other things can also be worked out. But let me be very clear that whatever cases, maybe 500, 600 cases which we have done till now about pain, we have got excellent results and it is instant. So I understand that our role is in pain control, and if we have to control the pain, this is the best method which we have developed. It is totally clean scientific method which can be associated with any of the oncology treatments so that patient's quality of life improves. It is non-pharmacological, it is external treatment, and I hope I have tried to explain whatever was there, and as we have seen that it has to be within time. So when we say instant, my lecture was also instant, and I hope I am within time. I have not said something which is tall claim, and something which you can practice in your own clinics and give results to your patient. It is so easy to learn. Yesterday I heard Dr. Joshi was saying that acupuncture and other things, these are similar to what we are talking right now. Acupuncture is actually derived from Ayurvedic Vedan karma, and we know wherever Gita has gone, Gita, Bhagavad Gita, everybody knows Sharashaya. Sharashaya was created for Bhishma Pitama to elevate his pain. That was one of the major things. And since then we are using Vedan Agni Karma for treating our patients to elevate their pain. Only thing is we have changed our outlook. बांसा से जीर्णा नहीं, जैसे पहले किया जाता था उससे हमने अलग क्या किया है, but we have changed. Just like Sadhu Baba, as we were saying, they have changed their language. Now Sadhu Babas speak in English. They give you inner engineering. So we accept that. That is what I am saying. That we have also changed, Ayurveda has changed, and we can definitely go hand in hand in scientific way. And I thank the organizers, the Tata Group and Tata Cancer Centers. I am having high hopes that we'll be having some integrative approach in future. Even our Ayurvedic advisors are here. So I hope I have been in limits. Thank you.
Thank you, Dr. Uday Kulkarni. Definitely non-pharmacological Ayurvedic modalities like Vidya Chikitsa and Agnikarma play a very important role. I just want a small comment from you because you demonstrated a really beautiful medical device which is, probably inspired from the scientific principles laid down in our text regarding Agnikarma. And you have designed a beautiful equipment. So, what is your experience? Since there are a lot of modern, medicine practitioners sitting across. So, what is your experience been that converting these modalities into, more scientific based and standardized devices? How does that help in better acceptance as well as better health outcomes, as far as these modalities are concerned?
Definitely. When we device, in fact, I have brought the device also. If somebody wants to have a